So now you're able to see the three scenarios, one of which will be your patient, where you'll provide a skilled therapy treatment at the day of your examination. Well, I wanted to spend a few minutes on each case to just help you in terms of considering what types of interventions may be appropriate and would be appropriate based on the problem list, which is what we're referring to here in terms of impairments, and then on plan of care and the short-term goals. So to continue the conversation we started on Thursday in AM Lab, with each of these cases, their evaluation has been done at minimal a few days ago. So they've had the evaluation and the treatment that same day, and then another treatment, and you're coming in for, at minimum, you're the third encounter with this patient in terms of physical therapy. So what that means is you will have a SOAP note from the last treatment, which will include those elements that you're becoming quite good at in your SOAP notes, which is the objective findings, the assessment, and the plan. So when you are providing that treatment, you want to be looking at the plan from the last treatment, and as it will tie into the plan of care in terms of interventions as well as the short-term goals. So this particular case involves someone that has a health condition of spinal cord injury and a spinal cord contusion, or a more vernacular way of looking at it is a bruised spinal cord. And as a result of that, they have weakness of their lower extremities, ankle and trunk muscles, in particular those trunk extensors. So this is somebody that would have a little more difficulty in a seated position, and may more than likely have some difficulty controlling the trunk and engaging those trunk muscles, particularly the extensors, to maintain their center of gravity over their base of support. So, but they have full upper body strength normal. So that's incredible helpful information as you see in the PT plan of care, and helping guide you as to what type of transfer you would be performing and what type of assistive device you may implement and use to help with that activity. Thinking about what you've been working on in terms of squat pivot transfers and slide board transfers, and what would be most appropriate on that day you're providing treatment based on the presentation, and playing it forward right from the plan of the last treatment note. And so they may arrive wearing AFOs because of the lower extremity weakness, particularly at the ankle joint, and they're going to have some challenge with seated balance. And we'll have more of a conversation about some strategies, but thinking of what we practice in lab and assessing, where are they stable? Can they reach and lift one upper extremity off of a stable surface, and can they maintain balance before you perform the transfer? And if not, is going to help guide you in terms of educating the patient how to perform that transfer. Along with that is looking at their energy, right? Energy conservation is, if someone's weak in their trunk, and we'll talk about this more on Thursday, is what types of strategies would you implement to allow that person to perform those important activities of daily living, including skin checks and donning clothes, putting on shoes and socks and pants, and what types of a transfer surface or a seated surface, not transfer, but seated surface, would they be in to give them the opportunity, or to give them the most optimal environment or condition to perform that activity of living of self-care and dressing without consuming a lot of energy. And you know, a more firm transfer surface certainly would be more optimal, and something feed surface, and something with some lateral support, such as a chair with armrests. So something to consider. And so the second case is the patient has this similar health condition. However, this is 14 days later. So they've had 2 weeks of therapy in a skilled setting. All three of these cases are in a skilled nursing facility where they're getting therapy often daily. And they have, in this case, a history of left heel ulceration. So that's skin check and education around skin check and care is so important, in particular skin check. And so they've had their short-term goals updated now because of the fact that they have been in care for a while. So there's progression from a mod to admissus as a goal for a stand pivot transfer. You practice stand pivot transfers as part of your experience as a student physical therapist assistant earlier in your lab practical work. But it's going to be based on, again, the plan from the last treatment. You know, what is the plan, and how does that weave into the short-term goals? Perhaps they're not ready to do the stand pivot transfer. Perhaps that patient may present with more fatigue. Again, my key word here is perhaps, and then it's using your clinical reasoning to make the decision as to whether or not to use an assistive device for transfer activity to progress and optimize energy, as well as providing the opportunity for the patient to participate as much as possible. So key here is you're performing mod, perhaps, and I'm thinking big picture, not max assist transfers, but a transfer where the patient is able to participate and as much as possible. So the final case involves somebody who, similar to the first case, has just started care a few days ago, skilled care. They have multiple sclerosis. So multiple sclerosis is a condition where fatigue can often be a factor. So that's just something to know, and something that you've learned in PTA 103 lecture, and we talked about it some in 100 as well. But what's different in this case is that you have some upper extremity involvement. So the C4T1 myotomes that you've become skilled at testing is part of this picture with this particular patient. And so this, in terms of findings and regarding the evaluation, there's also, in this particular case, I'll look at every case, that there's some sensory challenges for this patient below the knee as well. Okay, so you have this plan and short-term goal, the plan from the last treatment note, which you'll see at the time of your treatment, and weave it into the short-term goals with this in particular patient. And to really important to assess that readiness for transfers in each one of these cases, right? To look at their balance in sitting, to assess whether they have that strength and whether they are able to participate in the chosen transfer activity with or without an assisted device. And that is where your clinical reasoning is involved. So I look forward to seeing you again on Thursday, and take care.